Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these episodes, I bring you the latest developments in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X network, the Healthcare Now radio network, and our newest broadcast partner, the Health Podcast Network. For this episode, my 354th episode, I have one of my favorite guests and longtime friends back on air, Matt Ethington. Welcome back to the show, my good friend. How are you?
I'm well. Thank you. Thank you.
You got it, my good friend. First of all, before we dive in, this is a carry on from our last segment. You and I always have a great conversation. Let's dive in, though. You've done some really cool research, not on just also on your own, but also calculations that you've done specifically around the Medicare data sets that our good friend Anish Chopra made public about a decade ago. But it's getting much more robust every single day. Certainly as they publish this and they calculate more. So, and then you do your own calculations, which is fantastic. So, as a thought leader, as an expert in chronic care management, and all that we're doing here on the evolution in value-based care, share some of this cool stats that you've come across.
Sure. So here's I think probably the top three to share are chronic care management programs have a high attrition rate, right? They've hovered between 25 and 30% over the last 5 years of measurable data that comes from CCM. The surprising number is the RPM attrition rate hovers from 45 to 50%.
Wow.
But when you put them both together, practices that are doing RPM and CCM together, the attrition rate is below 10%. So it's I think that shocks people to understand, okay, there's a lot happening in the marketplace.
And I know on this last show we've shared some best practices, but what does that mean to you when you see some of those higher attrition rates? I mean, what springs to mind? What comes to mind for you, and what are some of the thoughts that you can share there?
Yeah.
For my audience?
So because I am a chronic patient, right? And because I care for two parents that required a lot of care. I know that patient engagement is what locks the patient in, right? So we're talking about high needs patients in a CCM program, often in an RPM program. And what that data points to me is if your doctor's doing remote monitoring, if he sent you home with a blood pressure cuff or a weight scale or something, they're monitoring those numbers. And if that doctor's also participating in CCM, that's the communication piece. So now not only am I getting data from the patient, but I'm also engaging with that patient. So that if you put together, that is a key for success that I've always talked about, is that these programs are designed to reestablish stronger doctor-patient relationships, and patient engagement is key to success uniquely, and that's exhibited by the fact of when they're done together, they're much more successful.
Right. So kind of launching off from that, and some of your thought leadership here is, we've seen a number of programs start strong and then lose momentum. I know you've done some good writing on this recently as well. In your experience, what causes a care management program, an initiative, to stall or fail to scale?
So after they've already started, right? They've launched, they're successful, et cetera. There are two reasons: providers aren't engaging or patients aren't engaging. And patients start disengaging if the providers aren't engaging. And providers don't engage if the patients don't engage. So it is that mutual relationship. And patient engagement, it doesn't mean that that you just gave the patient a blood pressure cuff and they're sending in data. It's a closed loop thing, right? Communication is bidirectional. So when a bunch of providers are enrolled, and they almost always enroll based on the provider's request, but they don't hear anything, right? They see a copay at the end of the month. they think, well, why am I doing this, right? If you're able to text back a response, email back a response, pick up the phone and call the ones that are engaged, just that reinforcement, because patients that do this, they do it
Right.
because they feel better knowing that their clinicians have their back. And then if for some reason you're not engaging those patients, right? You can't just enroll a patient and think that they're going to participate, right? You you prompt them, right? One of the things I always say is like if you just open the door to speaking with a patient on the telephone, they're going to tell you about their granddaughter that made the swim team in Seattle. If you send them a question instead of "You've been short of breath today," then you can get the information that you need rather than having to get on the phone for an extended phone call. So, engaging patients is really key. Correctly engaging patients is really key to doing these programs at scale.
Yeah. No, excellent. Great advice. So kind of following along there, what are the top 3 reasons you've seen patients drop out of these care management programs after the enrollment, and how are providers addressing that?
Well,
Or how can they, I would
so
say?
remember, patients are rational consumers, right? So all someone has to do is think about what subscription did I sign up for that I'll keep?
Hmm.
And so patients drop out because they don't see value. Right? That I'm getting all these questions, or um, I'm getting bothered with weekly calls, and then they just drop off once somebody hits 20 minutes, and it's not a closed loop type of communication infrastructure. So when patients don't feel value, they drop quickly.
Yep.
And a lot of people don't want to talk on the phone these days. So if it's a burden, I've got to answer your call and be stuck. So that's probably the biggest reason, right? They don't see value in
Yep.
continuing. There are a lot of natural reasons for discontinuation, right? The maybe the patients moved, maybe they've moved into assisted living, maybe they're uh, uh, something in their life has changed. Um, that's almost exclusively the reason that patients stop participating.
I also remember you and I were talking offline last week at some point, and you mentioned it's really important for the providers to share back the progress, because sometimes the patients don't see the progress on their own, but for the providers to actually, hey, here's how you're getting better, here's how things are working for you, because keep them engaged, but
Yeah.
also you're communicating
Yes.
bilateral communication.
Right.
So yeah,
So absolutely. The and the thing is that if you think these are high needs patients, they're relatively insecure, right? You're
right,
secure about things you know a lot about. And we in healthcare, we see patients, we see sick patients as sick patients. And sometimes what we forget is these are people with families and children and obligations and fears, and they feel isolated, and they don't they worry about taking up too much time, etc. So that closed loop piece of communication, just maybe even having a staff member. The great thing about these reimbursements are they don't require the doctor's time. They require
right,
staff members' time, and they pay so well. So if having somebody reach out to say, Mrs. Johnson, I just wanted to tell you your numbers look great this week, or they're much
there you go.
better, or hey, the doctor's seen these numbers. These are sneaking up a little bit, so we're gonna stay with you through this, but nothing to worry about. We've got you. That that's the thing that patients talk about to their neighbors and their friends, and that's why we hear from a lot of administrators that they increase referrals. They grow the practice confidently with increased referrals because it's a shock for many of them to find, wait, somebody from your doctor's office called you. um, so that really drives success, and it engaging them with questions, of course, but closing the loop. Hey, the results look good, etc. And that can be done via text. We're not. We think about some of these patients super elderly and they don't have smartphones. Listen, almost everybody has a smartphone now. You do have
Right.
the cohorts, right, in memory care that um, that and assisted living that really might not have those skills, but that phone call, that outreach, if it's simple and it's easy, then they'll participate.
Yeah, I know this is not about the money, but also, I mean, you and I have been talking for many years around this. I mean, the average practice can make $100 an hour doing care management, and you don't pay your staff that much. I mean, obviously the ROI is significant there for the practice owners. And again, it's not about the money, it's about the care. But what are your thoughts there?
Yeah, I wish I would prepared for this. I think we have over 170 million hours of time tracked. The company that I started, we've been doing this for
Yep.
a decade. So we have a
Yeah.
huge sample size, and it's remarkable when you see the amount of revenue generated on an hourly basis. And I don't think Medicare's gotten that word out very well. Like, hey, this is designed to be lucrative for you to engage patients between visits because we're trying to slow down disease progression of chronic diseases because it's breaking the bank. Um, but yes, the $100, I think it's a little bit larger than that. And if
Mhm.
you can have an
Yeah, I think
MA
so too.
just
Yeah.
checking on your patients, generating 100, if I could generate $100 an hour on staff, there
Yeah.
wouldn't be an empty office building in Atlanta. But
Amen.
it is,
Exactly.
but that's legit. We're
Significant.
talking, that's a huge sample size.
Yeah.
And it's true. It's true.
Yeah.
It is, it is an incredible lifeline for some of these smaller and struggling practices to realize that everything they do in the office between visits when they're not in front of a patient, if it's for a
Yeah.
Medicare patient, it's reimbursable.
Yeah, it's exciting. And something you and I have been joking about through the years, but absolutely true. And, sales solves all problems for young companies, just like patient engagement solves all problems for care management programs. What are some of the most effective strategies that you've seen keep patients meaningfully engaged month after month? And
Yeah.
we touched on it a little bit, but let's put some of these items out
Yeah.
for
It's a
our
great
guests.
question. So, first it has to be easy, right? The key to to changing human behaviors, make it easy, right?
Yeah,
That's why all these GLP drugs work in weight loss. You just take a shot a week,
right.
takes less than 15 seconds. Um, so when you do engage a patient, make it easy, right? And that's why we ask targeted questions around the patient profile. Is it's much easier for me to say, no, I haven't been dizzy this week, than it is for me to remember what I'm supposed to tell you when I'm supposed to tell you if it occurs. So prompting patients for engagement is a huge thing. And then especially for some of our more senior patients, they don't necessarily remember if they did this or that. So those prompts do two things. You get the answer that you need um, without having to hear about the granddaughter that made the swim team in Seattle. We love our patients, but we've got a lot of them to manage. Um, that's an easy way to achieve that. If you have a system that schedules phone calls for you to those patients that need a little bit of help, and then you have a list of the questions your MA needs to respond to, that makes it easier because your nurses aren't trying to find time, during lunch to call a patient. Um, and of course, it allows you to schedule more work done with specifically dedicated staff that are making you $100 an hour. It begins to make sense, but it's got to be easy. That's the key word. We use text, we use email prompts, and you can even jump on just a brief video check-in if you think that's helpful. So
Absolutely.
that's the key thing. Make it easy.
Make it easy. Love it. And for those of you that may join a little bit late today, my guest is Matt Ethington, co-founder and CEO of Chronic Care IQ and all-around care management expert. And again, for those watching on video, I do have these ropes. I have window cleaners out there, and I have these ropes swinging back and forth along the water. But please excuse anybody if you see someone drop down. All is well. Um, so, we talked about, practices that struggle, and some of them struggle to turn enrolled patients into billable ones. What are some of the opportunities that are being missed out there when it comes to codes like the new APCM?
Yeah, so that's perfect, right? Chronic care management's come a long way since it was first introduced in 2015, right? Had a host of these big requirements, and it literally, and this was, on the heels of EHR adoption, where physicians felt a little bit abused. So many of those things have been stripped away. There's one set of codes in 2015. There are now 8 different reimbursement categories and 31 monthly recurring codes that cover a lot of the work that's already being done in the office. So big expansion of codes, but a really significant one in 2025 was you don't have to, it's a lesser of a code. It's not as big of a reimbursement. And it's kind of a warm water entry into value-based care, into these value-based care codes. It says if you're tracking patients and you don't get to 20 minutes, but those patients have a care plan, they have been engaged in some form or fashion, there are 2 codes with reimbursements that will pay for that. So there's a complex and basically a non-complex code. And you may have 600 enrolled patients, but you've only significantly, maybe you got to 20 minutes, 40 minutes, 60 minutes, however, with a high number of them. But the additional codes cover the enrolled patients. So they make the programs remarkable. I mean, our programs are remarkably cash flow positive already, but they increase it. Medicare's really, really driving to get practices involved in virtual based care.
Absolutely true.
They're called APCM. I should have had the numbers and the reimbursements available for you, but I don't.
Well, we'll be doing many more shows, my good friend. This is, yeah, as you know, this is in my blood and my soul, and I absolutely love it. So I can talk about this stuff all day long, every week, and never gets old. We just need this so much as a country. And as you and I were talking off air, how many practices still have not started? The opportunity is so significant. The financial reward is significant, and the incentives are significant for practices, but still less than 10% of practices or providers in the country have begun any type of chronic care management programs, correct?
It's correct.
Yeah.
And look, in technology, right? We push fail fast, experiment, etc. In healthcare, first do no harm, right? I don't want to be the
Right.
patient that gets failed on. Plus, there's just a lot of noise around care delivery, reimbursements, and then audits and pre-certs and just a lot of meaningful use and numerators and denominators and extra work and rising costs. If you're in healthcare, your income fluctuates, but your
Correct.
labor costs don't. So things just keep getting skinnier and skinnier, and that leaves less room for the patient relationships type of things, and it's kind of created a little bit more of a framework for assembly line medicine. Like we got to see 25 patients a day to keep the lights on.
Right.
I don't have time to ask you about extra things that might be happening for a 65 to 70-year-old or something like that.
Right. But yeah, you use the right technology, the right innovation, you absolutely can scale in these programs, as you and I talked
Oh
about. And
yeah,
that's
they're
why we keep,
designed,
yeah,
they're designed to reestablish that doctor-patient relationship. And it sounds a little campy, but when you can digitally engage high volumes of patients with questions specifically related to their status, then they feel like they're engaged, and the patient replies to those. And then they might get a response that's automated, but somebody picks up the phone and said, "Hey, we've been looking at this." That
right,
Because you can do that at scale,
right,
and create individualized engagements at scale that really reinforce that patient. It's remarkable. It's so I said it sounds kind of campy sometimes. What we say, it's new technology that reinforces old-fashioned care.
Well, you and I were, yeah, but you and I were again talking offline, and you meant when we talked about how this new one of the larger programs in the country, a provider has a large program, thousands of patients. They were on your system for like a week and already saved 2 hospitalizations and maybe saved someone's life. I mean, that's why I get this. At the end of the day, that's why I get excited about this stuff. So,
Yes, that's a new
well,
one. They had used 2 systems prior to ours. I think probably one of the best compliments I've ever got in my life. She's an RN. They have 165 patients they see, or 165
providers,
providers,
yeah,
and they see
thousands of
patients
patients.
in their homes, in their assisted living facilities, in their independent care facilities. And she's just super plugged into patient care. And what she said was like, we use these two other systems and, they were just kind of lukewarm. And she said, when I saw ChronicCareIQ, which, when she saw our platform, she said, I felt like it was designed from inside my head. And it's true, right? If you're going to run a program and be successful, you already have death by 1,000 cuts with a bunch of things. So, and these programs, these codes, they have some specific guidelines, and if um, you can't really scale when you have a lot of variability, right? So you can automate what you can duplicate, and what people haven't put together is these codes are a business opportunity to create a virtual care service line for an existing practice. And that's one of the reasons that care management struggles, because if you ask me, what should I do as a type 1 diabetic? Well, I've been one for 20 years, so I have a pretty good idea. But a newly diagnosed patient that's had a heart attack is just home from the hospital, they might not know. Somebody that's had chemotherapy, right? And they get home and they're feeling awful and they have to know to take their temperature and call if this happens, don't call if that happens. And if you're dehydrated on Thursday and Friday, the number one reason for hospitalization over the weekend is dehydration. You should call your doctor. We don't know how to provide chronic care as a patient. So when we can plug the doctor back into that at scale, then we can improve outcomes. And the most successful programs we have, and we have hundreds of thousands of patients. It's remarkable. The ones that provide better care have financially much more stable practice and patient enrollment, right? And if you start to think about it that way, like, well, gosh, if we're reimbursing on time, non-face-to-face time for care provided to patients that meet certain criteria, well, then that increase not only does it improve outcomes, but it also improves revenue for the practice.
Yeah, so let's pick up. We have probably time for one more question. So this kind of picks up exactly where you just left off. Is what can practices? So this is talking about the 10% that have begun these programs or looking to optimize their programs. So what can practices do to optimize their existing programs? Where do you suggest they start first to optimize? Again, that 10% out there that's really begun these programs are doing well in them and they want to do better.
One that's doing well and wants to do better.
Yep.
Oh gosh, so you're talking about the high and going higher. Well, we've always looked at care management as a virtual service line, right? As a way to provide care to patients outside the office and check on them between visits, right? And catch them when they start trending in the wrong direction before we have advanced disease progression, before they do damage to themselves, before they show up to ED. So if you already have a program that has high patient engagement and high provider engagement, then if you're capturing all of that time, then I'm not sure I have a lot of suggestions for you. If you're not capturing that time, if you have a high patient count or you have a high provider engagement, but you're not generating, I think our average is $103 per patient, or you're barely getting to that first goal. Listen, when you have a patient with 3 comorbidities and they're taking 7 or 8 medications, I promise you, you're spending way more than 20 minutes on that patient throughout the week. There's so many activities. So look at how you're capturing your time. Are you automated? Are you scrubbing your caller ID logs, right? Are you counting what's happening in your EHR? Are you counting all of your nurse time, your dashboard time, the time you spend doing this? And then are you making sure that it doesn't overlap so that you don't get audited? And if you're spending too much time making sure that you don't get audited, then get a system that does all that for you so that time can be redevoted into clinical services to enroll more patients. So you need a lot of, if you want to master virtual care, you need a lot of data tools behind the scenes.
Yeah, no, that's exactly it. Because that's, no, thank you for that. And I think it's really important there's obviously maybe 0.5% of the market that's absolutely crushing it. But that question really was kind of for that middle group that, hey, you mentioned $100 per patient. We're at $48 a patient or $61 a patient. But there's a lot more opportunity out there. They're not capturing quite everything that they need to. So that's where that question was really, I think down the center of the line for them. And that's what we want to do, because we don't want attrition. We want to keep people growing in their programs and in more patients. And we want 15, 20, 30% of the marketplace, engaged in these programs. We want everybody, because as we've discussed, and I'm sure we'll have to do a follow-on show because we have much more content that I want to get to. And the right reason I love to do these shows is chronic care management is a natural glide path into value-based care. It's where the entire healthcare system is going over the next 2, 3, 4, 5 years. It's already here in many of our states and cities. So we just want to make sure we have the right foundation. We as patients deserve it, our country deserves it, and the providers deserve it for sure, because we don't want as much burnout as we have. But we are at time. So Matt, thank you again for joining me today. It's always great having you on air, my good friend.
Yes, and I'm grateful, and I'm happy to talk about care management and success to anyone. We set 2 goals, right? And the first one was change how healthcare gets delivered, and our business's mission is to relieve suffering, because it's tough. It's tough to be sick and not know what to do.
Yeah, well, we'll keep it going, my good friend. Absolutely. We'll carry on a third show. And a big thank you to all my listeners who voted and supporters who voted us 2024 Podcast of the Year. We are so grateful for you. Please tune in as this show broadcasts weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can find me on LinkedIn at Justin T. Barnes, or track me on Twitter at HIT Advisor, and use the hashtag ThisJustinRadio so we can respond to your comments from this show. If you missed any of this episode or want to hear more, all my radio shows are posted at YouTube, Spotify, Apple, iTunes, Amazon Music, Megaphone, SoundCloud, iHeartRadio, and TuneIn. I know there's a lot of content out there. We also keep on publishing the updates to the thought leadership page on justinbarnes.com. So check it out. Thanks, everyone. Have a great rest of your day.